Water. So I have heard about water in a bottle, water in a cup, water in a pot, in a dish, in a basin, but I have never heard about water in the brain or the head. Is there such a thing as having water in the head or the brain? Yes, there is actually such a thing as having water in the brain or the head, and I'm going to tell you about it. So today we'll be talking about a condition that affects children. Children are either born with it or they acquire the condition after birth. And today's topic is hydrocephalus. So what is hydrocephalus? Well, hydrocephalus in simple terms is the accumulation of fluid in the cavities or spaces within the brain cavity. So within the head, there's accumulation of fluid. And this fluid is naturally occurring. We do have this fluid in the body. We have it normally. And the name of the fluid is cerebral spinal fluid. Now, this cerebral spinal fluid covers the brain, nourishes it, and gives food and nutrients to the brain, as well as also acting as a shock absorber, whereby if the head hits against a hard surface, for example, the brain will not have direct impact onto the skull, but it's going to be floating in that fluid. So this fluid is actually good. It protects the brain. But then sometimes this fluid is produced in excess. So now the normal route of this fluid is that it is produced in the brain and then it travels down the spinal cord, which is the backbone, and somehow gets absorbed by the body, and it's just normal like that. But sometimes the fluid is overproduced in the brain. Number one, it's either overproduced that the rate of absorption is lower than the rate of production. So there's an accumulation of extra fluid. Sometimes the normal fluid is produced in normal quantities, but along the route, as it is going to be absorbed, let's imagine something like a hose pipe or a tube. So along this tube, there's a constriction somewhere. So instead of all the water passing through, it is being squeezed and just a bit is passing through, meaning the other one is just remaining and accumulating in the brain. What are some of the causes of this hydrocephalus? Well, hydrocephalus, like I mentioned earlier, could either be congenital, meaning you are born with it, or it could be acquired. Acquired meaning that you can develop it after birth. So now, how does one develop hydrocephalus after birth? Okay, so there are some certain diseases or infections that can lead to one developing hydrocephalus. For example, head injury, bleeding or clots in the brain, tumors, or meningitis. And remember, this hydrocephalus is mainly observed in children because children's bones are still soft, they haven't yet fully matured, or they haven't yet fully been formed to be hard. So, like in the brain or in the head, on the head, the skull, the bones of the skull are not compact, they're not complete, they're not fused. They're still floating, so they've got spaces between each other. So there's a bone here having space in the middle, another bone there. As an individual grows, these spaces start narrowing until finally the bones fuse into each other. But hydrocephalus in children causes the head to now start bulging because these spaces are still communicating with the skin, if I could put it like that. So there's extra space for the bones to separate and the head to grow bigger. Unlike in a fully grown adult or one that is above 5 years old, the bones are fully fused. So if there's water accumulation, it will just be contained within the brain because it has no spaces of escape. Several tests could be performed to ascertain whether or not it is hydrocephalus, and some of these tests include a lumbar puncture, an intracranial pressure monitoring, as well as a CT scan. So about hydrocephalus, we're going to end here today. We're going to continue in our next video. Thanks for watching. If you have any comments, questions, or contributions, please pass them down in the comment section and I'll be very excited to read them. Thank you so much. Bye-bye.